Hello, everybody. Would like to welcome you guys here today to our presentation on age-appropriate and inappropriate sexualized behavior. This presentation is brought to you guys by us here, the BSF team with VMS Family Counseling Services. Would like to just remind you guys that this presentation will cover, like mentioned earlier, appropriate versus inappropriate sexualized behaviors, as well as we will cover some of the different stages of development and what to expect versus what to see as red flags. Hopefully you guys can gain knowledge and understanding of what is appropriate to be observed during the different stages of development versus what is inappropriate. So without further ado, let's get this rolling. Before we jump further ahead, I would like to introduce myself. My name is Jesse. I am one of the BSF trainers here at VMS Family Counseling Services. Just as a reminder, why are you here today? Again, why are we here today? Again, we are learning about age-appropriate versus inappropriate sexualized behavior. One of the things that I would like for you to keep in mind is just to keep an open mind. This is a very touchy subject. Anything that has to do with sexualized behavior or children and sexualized behavior is always a touchy subject, and not all of us like to talk about it. And so this is definitely an important subject to talk about because we are going to be observing some of these things with the children that we are working with. Again, all of us have our different opinions as to what is appropriate versus what is inappropriate, what you want to deal with versus what you don't want to deal with in your home, etc. But we have to keep in mind that these children come from different backgrounds. These backgrounds and these different traumas that they have experienced sometimes play out in them exhibiting sexualized behaviors. Like stated, every situation is different. So hopefully this presentation is a resource for you and your family, and you can use some of the information in your homes. In acknowledging that this presentation is very touchy, we have a disclaimer slide. So please be advised, sexualized behaviors are a very touchy subject for many people. This training is in no way addressing whether or not a behavior is morally appropriate or that a child should be doing it. 2, the primary aim of this training is to identify and address. What are we identifying? We are identifying age-appropriate versus age-inappropriate behaviors. So based on the stages of development, where a child would be at and what is appropriate to be observed and what should be observed versus what is inappropriate once observed and what we should be seeing as red flags, okay? And how we are going to be addressing these situations. Thirdly, when we talk about age groups, please keep in mind that there are different forms of development and age is just one of them, okay? So moving on, we are going to talk about the goals for today's training. Number 1, to help parents and caregivers distinguish between age-appropriate and inappropriate sexualized behaviors. One of the things, just like mentioned earlier in the previous slide, one of the things that we are really going to be emphasizing is those red flags. What are we looking for that is going to tell us, okay, this is not okay, this is not supposed to be happening at this age and stage that this child is in. Therefore, what's going to be the next steps? Okay, the next steps may include having to report the incident. So again, we're definitely going to be addressing that in our presentation. Number 2, to help parents and caregivers gain knowledge about why some behaviors occur and the purpose that they serve. Yes, it is a fact that not all sexualized behaviors are inappropriate. Depending on the age and stage of the child, some behaviors may be totally appropriate. And so that is definitely another thing that we are going to be addressing and talking about in our presentation. Number 3, to help parents identify creative strategies to support children in addressing sexualized behaviors. These conversations are hard, and sometimes we don't know how to deal with some of the issues that come up, especially when they have to deal with sexualized behaviors. So we are definitely going to include that as part of our discussions today. Number 4, to give parents the opportunity to ask questions, discover why some of these behaviors are particularly problematic for parents and caregivers to manage. Definitely, like I mentioned earlier today, make sure you keep an open mind. A lot of these conversations, especially in regards to this topic, are very touchy. And so, again, we are not all comfortable in talking about them. So, we're definitely going to try to make ourselves as open-minded and as comfortable as possible. Hopefully you are in a setting where you feel comfortable and ready to engage in learning, and we're going to get going. What is sexual development? So in this particular slide, we're going to be addressing what is healthy sexual development and what that looks like, and what is of concern during sexual development and what that may look like. So let's define this. Healthy sexual development involves children becoming more aware of their own body, beginning to understand the differences between their bodies and the bodies of others, and finally, being able to recognize things that they feel comfortable with sexually. Sexual development, as defined by the National Child Traumatic Stress Network, begins at birth. Sexual development includes not only the physical changes that occur as children grow, but also the sexual knowledge and beliefs they come to learn and the behaviors they show. Any given child's sexual knowledge and behavior is strongly influenced by these three things: the child's age, what the child observes, and what the child is taught. Again, those three particular things are very important in the development or the sexual development of the child. Areas of concern during sexual development. So, when a child experiences sexual abuse, their sexual development is altered. Two different ways that their sexual development may be altered. Either one, the speed of sexual development may be increased, or two, the speed of sexual development is going to be decreased. How does it look like when that speed is increased? So because of the experience that they have, the children may experience more sexual interactions. Their bodies may actually respond and start to develop more quickly. The use of words, sexually explicit words, may happen. An increase in occurrences of sexual exploration, curiosity, and in regards to just their own body. When speed is decreased, children, adolescents, adults will often avoid anything related to sexuality because they are fearful of what has happened to them in the past. A total, complete shutdown of the exploration of their sexuality and who they are sexually. Jumping into the ages and stages portion of our presentation, let's start by talking about our young kiddos, our toddlers, ages 3 and under. So let's talk about generally what is appropriate during the ages of sexual development, or during the stages of sexual development of children that are 3 and under. Number one, of course, the exploration of self and others. During this stage for toddlers, it is completely normal to be exploring and be curious about their environment around them and the things that are going on around them. And of course, with that, it is also normal for them to be exploring themselves and others, how they are different from you, from me, from everybody else. It's normal, completely within the realm of normalcy, to be exploring the differences between other beings. Number two, asking questions about their own and others' bodies. When the child, 3 and under, of course, becomes verbal, it is perfectly normal to also them to express curiosity and wanting to know more. Just asking those questions is completely normal. Number 3, talking to other children around their age about bodily functions such as poop and pee. Again, going along with what we were talking about earlier about just exploration and just being curious about the environment around them, about themselves, about their bodies, this also falls within the realm of normalcy. And number 4, inadvertent self-stimulation / gratification. Yes, it feels good. Yes, I'm going to do it. So again, such things that you may observe are things such as, touching, rubbing against other objects, things of that nature, that inadvertent self-stimulation is going to happen because, again, it feels good. Let's talk now about the areas of concern. What are those areas that are those big red flags that we should definitely be worried about? So, definitely one of the things that we should see as a big red flag is any sexual behavior towards others. Any of that sexual behavior towards others, any explicit imitation of sexual intercourse, things of that nature towards others is definitely a big red flag, particularly if it's being done towards adults. Okay? Number 2, experiencing or displaying fear related to others attempting to help them stay clean. Again, this is one of those areas in which if you are experiencing this in your home, definitely something that is going to raise a red flag and make you ask, maybe be more observant and or ask a little bit more questions. Okay, number 3, inserting objects into themselves or displaying behaviors that are highly sexual in nature. Let's explain that just a little bit more. So displaying behaviors that are highly sexual in nature. What does that look like? So one child coercing another into participating into a sexual act is one of those behaviors, or just like we talked about earlier, that explicit imitation of sexual intercourse is definitely another one. Another example of this highly sexual behaviors in nature is oral genital contact. Another example is asking an adult to perform specific sexual acts. So definitely those are things that are big red flags that you should be on the lookout for, especially when working and dealing with kids who are 3 and under. Information to know, or information that you might want to share in terms of the sexual development of kids that are 3 and under. Things that you might want to share with them are definitely things like boys and girls are different. As well as making sure that you are naming their body parts accurately, or giving appropriate, accurate names for their body parts. Also, information such as babies come from mommies. That is important information that sometimes we don't share because we may be hesitant as to what information is appropriate at what ages. But definitely for a 3-year-old and under, that is definitely an appropriate thing to share. Rules about personal boundaries. What is okay? What's not okay? What's my space? What is your space? And such. And also give simple, straightforward answers about bodily functions and bodily parts. Being as truthful and as honest as possible with the kids when they are asking questions at the point where they are curious. That is extremely important. Don't give them false information. That is also extremely important. Sharing false information leads to not knowing the information, and it leads to doing things that may be inappropriate because of that information that was shared with you was wrong. Safety tips. Some of the safety tips in regards to the information that you want to share with the kids is definitely ensuring that they know that their body belongs to them, that it is their personal space, that it is nobody else's property. Another thing that you want to share with the children 3 and under is everyone has a right to say no. If they are asked to do something that they don't want to do, they have a right to say no. And it's important for them to understand that, because sometimes some of the messages that we share are always listen to adults, always listen to your teachers, always listen to your elders, so on and so forth. But it's always extremely important to be extremely aware that sometimes our kids will be alone or will be in the presence of another care provider, and it is definitely okay to share with them that when things are not appropriate, or when they feel that something is wrong, or when they don't want to do something, then it's okay to say no. Also, the difference between good touches and bad touches. What is an okay touch versus what is a not okay touch? can't say how important that message is. So, especially for a child who is 3 and under, definitely one of the safety and precautionary measures that you want to take in terms of the conversations that you want to have with them, that is definitely up there with them. Also, who to tell, who to tell, who to when you're in trouble or when something has happened or when you need to get information to somebody, who to tell, especially when something has happened that you don't necessarily want to have happened, or if you were in a bad situation, who do you go tell? Do you go tell your mom? Do you go tell your dad? Do you go tell the principal? Do you go tell the teacher? Do you go tell the social worker? Who do you tell? And depending on where they're at and where they are. Continuing with the ages and stages portion of the PowerPoint, now let's talk about the ages from 4 to approximately 10 years old. So what can be considered generally appropriate in terms of sexual development for these stages, or for these ages, I apologize. One is that continuing to be interested in the body parts of others. Curiosity is definitely something that is going to remain throughout this general age group, just because it's a time where we are learning about not only ourselves but also about others, and so that curiosity piece about those differences that make us want to know more, those are still going to be persistent in this particular age group. 2, accidentally finding sexually stimulating activities and engaging in those behaviors again. Definitely, if it feels good, again, most likely you are going to repeat it. And so as part of this, some of the things that you may see are, again, that touching, that rubbing, that possibly rubbing up against an object or a thing. Again, if it feels good, it is likely to be repeated. Unless, of course, it becomes a situation where it's excessive and aggressive, then it's particularly normal for this age group to continue to express themselves and explore themselves in that way. Number 3, particularly with younger children, it is generally age appropriate to not be as modest or concerned about their body parts. Again, not only with the younger group but also with this group, they still have not developed the concept of privacy per se, and so therefore they're just a little open in terms of their body parts. Things that are of concern that we definitely want to raise and talk about here at this age group from 4 to 10 is definitely sexual acting out with children who are significantly younger or attempting to act out with older children. So here's where we start noticing our first difference. If you notice from our previous age group, it was acting out. One of the areas of concerns was acting out with older, those who are older or of the same age. Here at ages 4 through 10, one of the things that we start to notice is that it varies now. Now the children may start sexually acting out with children who are younger than them, of the same age, or older than them. So again, those are areas of definite concern, things that will raise immediate red flags, and definitely things to keep in mind when working with kids who have been victims of sexual abuse. Number 2, displaying sexual behaviors that should not be known by a child of this age. So, sexual behaviors, again, exactly what we talked about in the previous slide in terms of those explicit sexual behaviors that can become present. Some of those, again, including, let's say the child is coercing another into participating into a certain sexual activity. Another example, again, just like I previously gave, this child is having explicit imitations of sexual intercourse. Number 3, oral genital contact. And another example, number 4, asking an adult to perform a specific sexual act. Again, this child, for this particular red flag situation is displaying sexual behaviors that should not be known by a child of this age. And number three, finally, spending unhealthy amounts of time with self-stimulating activities. Self-stimulating activities can include masturbation, of course, repeated penetration of vagina or anus with an object or digit. This is all when it's happening frequently, when it's happening repeatedly, and spending too much time doing so, it's one of those things that it would definitely raise a red flag into looking into a more serious type of way to address the situation. Moving on to the information to know and share for this particular age of development from about 4 years old to approximately 10 years old. Some of the basic information that you want to share in terms of ages and stages of development and sexual development in this particular age group is to continue to let your boys and girls that you are working with know that the bodies change and they continue to change as we grow. So they know that for themselves and their own bodies, there's going to be change, unexpected change that's going to be coming. When appropriate, please address that. And it's okay to completely address that straightforward and in a conversation with them. But it is one of the things that is extremely important for them to know. Again, when the situation comes up and when the questions come up, make sure to have those simple explanations of how babies grow in their mother's wombs. Absolutely do not make up a story of where babies come from or this magic fairy of how babies get dropped off or other imaginary explanations as to how babies magically appear on Earth. Please be as honest and as truthful with them and as realistic as possible. The reason for that, again, is so that they are starting to develop an understanding of how it all works. And it's natural for the kids to have curiosity, and so you want to feed them with as much facts as possible. Number three, rules about having personal boundaries. Rules about having personal boundaries is extremely important. What is their safe space, and how do they define it for themselves? And so to make sure that they are thinking about that, how close do I want to be to somebody? How distant am I okay with somebody being from me when I'm having a conversation? So on and so forth. Again, these rules about personal boundaries, personal space are extremely important, again, to reinforce, just having appropriate relationships. Number four, one of the things that you definitely want to have is that privacy conversation, and start creating that sense of and that need for privacy amongst the youth during this age group. For example, one of the subjects that can come up is, touching your own body parts can feel nice, but it's something that needs to be done in private. Again, these are sometimes very difficult and touchy subjects to address because sometimes it's just going to happen out of nowhere, and you are going to be caught off guard, and for whatever reason you're not going to be able to think of something appropriate to say at the time. You might think of yelling or screaming and being like, what are you doing, so on and so forth. But again, it is always appropriate to have those conversations, and it is okay for them to explore. It's okay for them to touch themselves and want to be curious about their bodies and why things feel good and why things don't feel good, so on and so forth. But it must be explained to them that these are things that are done in private, and when you explain that to them, you also explain to them what is appropriate versus what is inappropriate, and you have those conversations with them openly. All right. Moving on to safety information that is important to note during, and important to note, and not only important to note, but also important to share with the youth this age group. Sexual abuse is when someone touches your private parts or asks you to touch their private parts. That conversation about sexual abuse needs to happen when appropriate. Again, a 4-year-old is probably not the most appropriate person or is not at the age in where you are going to be having this particular conversation with, but it might be. It might be in the sense that this 4-year-old might be have been a victim of sexual abuse and you may need to have these particular conversations in order for this 4-year-old to understand the concept of not only privacy but appropriate touch and appropriate boundaries. So again, these conversations are extremely important in regards to keeping the child safe if this child has already been exposed to sexual abuse. It's important to reiterate as well to the child that has been exposed to this that it is sexual abuse, even if it's by someone you know. As we know, most sexual abuse cases happen, or the perpetrator is someone that we know. And so, again, it is important to note that we cannot minimize these situations. It is sexual abuse is sexual abuse. Also, for those children who have experienced sexual abuse, it's important for them to know and it be reiterated that sexual abuse is not the child's fault. It is not their fault. Finally, who to tell is an extremely important thing. Again, just like in the previous age group, this is extremely important. Who do you tell? Who are the safe people around you who you can go to and tell and give information that something is happening that you are not okay with, something is happening that is potentially going to be harmful to you? Who do you go and tell? And so it's important for you as a care provider to start identifying those safe people, not only around you, but for the child to start picking those people out, not only in their schools, in their clubs, in other places in their environments, such as when they're out in the community playing sports, or when they're out at the park, so on and so forth. So again, making sure that they know who they need to go tell when something is not okay or something is being done to them that is not okay. So coming back to this portion of the ages and stages portion of our PowerPoint and our presentation again. So now we're going to talk about ages 11 through 13 in terms of their sexual development at this age and stage. So generally, let's talk about number 1 here. You will see them becoming sexually interested in other children of their age, rather than just interested in what makes them different. As we have noted in previous ages and stages of this PowerPoint, during earlier stages, the children are more focused on what makes them different. At this stage, that changes. Now they're becoming more sexually interested in physical appearance, looks, smells, things of that nature, and are also becoming more interested in kissing, holding hands, having boyfriend, girlfriends, having those small relationships, touching. Those definitely are things that are more prevalent and actually of normal age appropriate at this stage. Number 3, looking at pictures of naked people. Yes, again, that curiosity piece is one of the pieces that just never goes away. I mean, we're always going to be interested not only in exploring ourselves, but also just that curiosity of what does the other sex look like, looking at the things that not only at this point are you're starting to figure out that hey, maybe this is turning me on a little bit, and I'm interested in this. And so looking at pictures of naked people is definitely one of those things that during this age range, because not only of curiosity, but because also it's now an understanding that you are interested in this, it's quite normal to see. And I'm sure plenty of you foster parents have experienced this in your homes. If you have teenage boys or maybe teenage girls in your homes and have had the opportunity to have conversations that are regarding sexual development or their sexual development because of their curiosity. And number 4 here, wanting more privacy is definitely one of the things that you'll start noticing, and being reluctant to talk to adults about sexual issues. Just that shyness again. and wanting that more privacy because they understand what privacy means, and they seek privacy because they know that certain matters are private matters. And of course, that reluctance to talk to adults about sexual issues, and that just comes from just nature, of us as humans, and as we interact, it's sometimes difficult to have these conversations for which we have grown up all along are private conversations, are conversations that sometimes may be taboo, and so they're not so easy to have. And finally, they start to have a sexual attraction or interest in peers, and that, just like what we talked about earlier in this slide, it's just that interest in not only kissing, holding hands, touching, just that feel, the smell, just being around that other sex or the same sex. It starts to become more of an attraction, and they start to seek it. They start to want to find out more about it. Again, it's that curiosity piece that just never goes away. Talking about areas of concern. So this is again the areas of concern that we should definitely see as red flags during this age group of 11 to 13. Number one would be, these are if you start seeing children who are sexually acting out with children who are significantly younger or adults who are older. Again, it's just with that last stage that we talked about from ages 4 to 10. We have to watch out for if there is sexual engagement, or these children are sexually acting out with children who are younger than them or who are older than them. Those are the big red flags, things that we need to just automatically, if this is going on, this is a big red flag, we need to address it. Number two, seeking out sexual experiences, such as engaging in what appears to be voluntary child sex work. Yes, it could be something to that degree, to which appears to be this child engaging in child sex work. But at this age, from 11 to 13, if this child is seeking out sexual experiences, then that is also a red flag, and things that may need to be addressed a certain way. And it may not be something that that is so intense, or in a way something that has to be addressed in a negative fashion, to where we are shaming the child, and telling the child that what they are seeking out or what they are wanting to do is wrong. It's more about the education piece. But if you see again a child who is constantly seeking out sexual experiences, that is a big red flag, and something that definitely needs to be addressed. Number three here, wearing highly suggestive clothing, using sexualized language, and talking about sexualized behaviors with many different people. All of these things are big red flags. Big red flags, because this means this child is or was exposed to this before. The suggestive clothing, the sexualized language. You don't just learn sexualized language on your own. Where is this child picking up this language from? Talking about sexualized behaviors with many different people, and that comes again with not only the privacy part of it, but also what is appropriate, and how are you creating appropriate relationships when all the conversations that you are having with different people are sexualized to some extent. And so again, this is where you start to ask questions, and it definitely does raise a red flag, and in terms of this needs to be addressed. Moving on to share some of the information to know and to share with the children of this age range, from 11 to 13 years old. Important to note, in terms of their sexual development, that they are going to be more curious and have a lot more questions, and sometimes we're going to feel like we are unprepared to answer some of these questions. Again, one of the things that I have reiterated and will continue to reiterate throughout this presentation, is to make sure that if you do not feel comfortable sharing some of this information, you don't feel knowledgeable, you feel like your answers may not be enough, please always find that space, or find that organization, or find that person that is able to carry on these conversations and factual conversations with the youth that you are working with. These people, again, can be social workers, can be service providers such as RAP, can be other community service providers such as Planned Parenthood, other providers, or school personnel such as a school nurse, that can provide information, valuable information that these youth need, and factual information that these youth need. So again, some of the basic information in terms of their sexual development that you want to share, suggestions that you'd want to share with the kids from 11 to 13 would be what to expect and how to cope with the stages of puberty. So knowing that around this age, from anywhere from 10 to about 13 years old, there's going to be a lot of changes, a lot of hormonal changes, a lot of body changes. They're going to start noticing a lot of things appearing, such as hair, and their voices changing, and things of that nature. And so you want to be prepared and ensure them that these changes are normal, that this is part of growing up, that this is part of their sexual development. And so you want to just have these conversations with the children that you are the youth that you are working with that is about this age. And when those questions come up, again, you're not just going to randomly have these conversations. These conversations will usually come up because they have questions. And so that's when to have these conversations. You don't just want to just schedule a conversation and say, hey, tomorrow we're going to have a conversation about this. Remember, these conversations will naturally come up because questions do come up. And the children and the youth at this age start noticing the changes, and they will have questions, and they will usually try to reach out to you in some way. Another suggestion for information to share is basics of reproduction, pregnancy, and childbirth. Previously, we had talked about for the younger youth is just to have a basic concept of where babies come from. At this stage, the conversation has to be just a little bit more in depth of the functions of our reproductive system. It doesn't have to be too complicated or too complex, but just the real basics, the gist of how we reproduce, what is pregnancy, what are the terms, and childbirth. Real basic information. Does not have to be too in depth, but the information that you do provide, please let it be factual, not opinion based. Okay. One of the other suggestions that we have on here is just to have those conversations of what are the risks of sexual activity. What are those risks? Whether it be the risk that, hey, you might get somebody pregnant, or hey, you might end up in a situation where you are pregnant, or you might end up in a situation where you get a sexually transmitted infection. And so we must have those conversations. Those are definitely tough conversations because you don't ever want to imagine a child 11 to 13 who is already sexually active. The fact of the matter is that sometimes we don't know, and sometimes these children are in fact sexually active at this age, and we want to be open about it, and as open to providing as much factual information to them, where to go get supports, because you want to make sure that they are at the very least being safe and taking care of their bodies if they are choosing to have sexual intercourse or interaction, or are exploring their bodies in sexual fashion. And so again, these are definitely conversations that you do want to have. That risk of sexual activity, and what does that mean, and what are the implications to their body. Again, reiterating that if you're not comfortable having these conversations, you don't necessarily have to be, but you have to be aware that this is happening. You can't just hide it under a rug and pretend that this isn't happening. And so, by making yourself aware and acknowledging it, you are seeking places and people that can help support you in providing this information to the youth. Another one of the things and suggestions that we have on here is the basics of contraception. Extremely important, whether it be birth control, whether it be condoms, whatever the conversation is or leads up to. Please make sure that you are having that conversation. Again, there are agencies that provide those services, so if you don't feel adequate or if you don't feel like you have the appropriate information, please pass that on. It only takes a simple Google search to look up information on where to get this support. Okay, next one is masturbation being common. Of course, but should always be done in private. Yes, again, the realization here is that these children, these youth, are at that stage where they're continuing to explore themselves, their bodies, and what feels good. And we must, find a way to cope with that, even though we don't like to think of our kids, our youth that we work with in those stages, or sometimes we don't know how to answer some questions, or sometimes we ourselves may feel shy or overwhelmed because those are hard questions to answer, and those are intimate questions to answer. And so again, but it is without putting any moral judgment on it, masturbation is common. And one of the things that we want to make sure is not to alienate a child or tell a child that this is wrong, that this is bad, and judge them for exploring their bodies. And this is part of sexual development. And so definitely we would definitely, instead of the judging and pointing fingers, we definitely want to acknowledge that and let these kids know that this is a privacy thing. These are things that are done in private. And so just for them to be able to protect their own and acknowledge that these are private issues or private situations that happen behind closed doors. And it's definitely okay to explore. Some of the safety information that you want to pass on in this for this particular age group is that sexual abuse may or may not involve touch, especially in this day and age with so much social media and so easily having access to the internet and all the information that the internet just brings to you just in a flash. It's important to know that sexual abuse may not necessarily involve touch. It may just involve the sharing of pictures. It may involve the sharing of videos. It may involve the use of words. And so again, it's not always and not only defined by touch. Number 2, how to maintain safety and personal boundaries when chatting or meeting people online. Again, with this age of social media and the access to all of these apps and the internet, and just how easy it has become to meet people from all over the world, not just from your local vicinity. It's important to have these conversations. This is a particular safety conversation that is extremely important, especially in this age from 11 to 13, because again, they are seeking they are continuing that curiosity stage, and where they are actively online, and they are so easily influenced by information. And so definitely having those conversations on what is appropriate when we are on the internet. What is chatting going to look like? Are we going to have access to this at this age? Is the child of age, and 2, is the child mature enough to handle having chats or meeting people online? And that is something that as part of prudent parenting, you're going to have to kind of dissect and see if this is something that is okay, and that is going to be allowable in your home. And so again, these are definitely safety information, safety conversations, things to be aware of that you must kind of analyze and assess at the time that it does come up. Another thing is how to avoid risky social situations. So, again, with the children, youth of this age being curious and wanting to explore and seeking more independence, that seeking of independence sometimes lead to, I want to go to the movies by myself or with a friend. I want to go hang out with my friend so and so, and we're going to be hanging out at his house, but his mom's not going to be there until after 5 or 6, but we're just going to play video games and so on and so forth. So you want to have that conversation on what is appropriate, what is not going to be acceptable, and so that the child or the youth of this age is aware, and so that they are aware, hey, what is can lead to being a putting yourself in a potentially dangerous situation. Lastly, dating rules. Yes, kids of this age are dating. If you have any youth or have worked with youth of the ages from 11 to 13 or just 11 to 15, you see that dating is huge. And so that is, it's encouraged for you to have those conversations on, what is appropriate, what is going to be inappropriate, what does dating look like, even having those conversations of what is a supportive partner versus what is a partner who is not very supportive and who is abusive. And so having those conversations is going to be one of the best ways to help support the youth around this age. And that is going to be defined by you and the child and the youth that you are working with, because every child is going to be different that you're working with, and every child is going to have a different situation going on, and some may be ready, and some and be acting out and exploring all these areas, and some may not. And so again, it all depends on what's going on in your home. Moving back into the ages and stages portion again, and here we are now talking about ages 14 plus, the teenage years. These are the hardest years, definitely, because why? At this point, the children are definitely trying to seek as much independence as possible, and so there begins to be a rift that is formed between yourself as a care provider and them as a team, because they want to seek out all this independence and want to do so much independently and ask little, whether it be permission or questions to you, because again, sometimes when teenagers tend to think that they have the answers to everything, that they have experienced everything, and so a lot of the times we get this backlash instead of being able to work together and being able to talk through situations. So in terms of sexual development, the teenagers are at this point, some of the things that are generally appropriate and generally observed are, teenagers wanting to engage sexually with other children or adolescents of their same age, general age. And that is actually just based on the stage of development that they are at, and sexual development that they are at is quite common, again, because they are in relationships. They are seeking to explore feelings, emotions. They are already kissing, touching, creating bonds, and so naturally urges come up from the body, and things and youth of this age want to explore that. And so that's definitely one of the things that is generally appropriate. Two, asking questions about sexuality or physical development. You're going to get a lot more questions. You're going to get just in terms of sexuality, in terms of just physical development, because a lot of changes are happening during this time still. Again, some children reach puberty at an earlier stage, and some youth reach puberty at a later stage. And so again, there's still going to be a lot of questions. And sometimes these questions are not going to be directed at you. Sometimes they are going to find answers on YouTube. They're going to find answers from programs they watch. They're going to find answers from their friends. They're going to try to seek information out, and so it's important for you to just be aware of that. Be aware of just the array of information that is out there, and keep that in mind. And keep that in mind only because you want to be ready for when this youth, or you feel it is appropriate to have these conversations with the youth of this age. Again, not all youth of this age is going to be willing to accept the information that you provide, but there's always going to be an appropriate time to have these conversations, because you are going to notice things in their behavior pattern, or things that they do, or how they're acting, so on and so forth, that's going to just say, hey, maybe now it's the perfect time to have this conversation with this child or with this youth, so that they are better prepared, and so that they don't feel that I am somebody that they have to hide information from. Number 3, engaging in more activities related to self-stimulation. Again, the masturbation, the self-stimulating, touching, rubbing, so on and so forth. This is definitely the stage and age in which it is more common, and it happens more often. Okay. Number 4, choosing to engage or wanting to engage in more sexually intensive behaviors. Again, just going along with what we had stated earlier in the slide, it is all part of the exploration piece, that curiosity piece, that piece in which they have built relationships, and have started boyfriend and girlfriend, seeking out romantic relationships, and it's all part of just exploring. And yeah, naturally, hormonally, your body is going to want to explore more. And so this is all part, and it's all definitely a normal part of the sexual development of teens and youth at this age. Areas of concern. Areas of concern that we're going to talk about are just the pretty big red flags that we are going to be watching at this age, or from youth that is around this age. For example, number 1, engaging in sexual behaviors with adults or individuals who are significantly older or younger than they are. Definitely something to be wary of, especially with CSEC, especially with just being aware that you know teenagers and kids of this age are at high risk of being victims of CSEC. So just keeping that in mind, if you are noticing that, or if you have noticed that your youth or the child of this age is engaging in sexual behaviors with adults, or people who are significantly older than them or younger than them, that is the big red flag. It needs to be addressed immediately. Number 2, children who seem to be attempting to utilize their sexuality in order to get what they want. Definitely the big red flag. I don't think that needs much explanation. It pretty much says it right there. Manipulation. If they are using their bodies to get what they want, to get money, to get, to get a certain object, and so on and so forth. If this is happening and this is something that you're noticing, please, red flag right away, needs to be addressed. Number 3, making sexually suggestive comments to resource parents, yourselves, or other closely related adults. This is something that you, as a resource parent, can be touchy, because sometimes you won't know how to react if this happens. And so, but as soon as it does happen, this is definitely reportable. Things that have to be made, you'd have to make your social worker aware. You'd have to make the appropriate people aware that this is happening, because again, and it's not only saying that this child is having or making some decisions in terms of their sexuality and being inappropriate about them, but it's also saying, hey, this child and this issue needs to be addressed, because it can potentially lead to other negative situations. And so Definitely something that is worrisome and needs to be addressed ASAP and as soon as it's noticed. How does sexual abuse impact children's sexual development? So, better noted by the National Child Traumatic Stress Network, um, research has repeatedly shown that child sexual abuse can have a very serious impact on physical and mental health, as well as later sexual adjustments, depending on the severity and the number of traumas that this child may have experienced. Child sexual abuse, again, can have wide reaching and long lasting effects on an individual's mental health. So, these are the two areas in which we are providing examples here on this particular slide, both physically and emotionally. On the physical end, things that can be observed or noticed, or things that can possibly, implications that can possibly be had, are one, on the physical end, increased amounts of hormones that are present in the child's body. Two, you can notice an increased speed of physical development. Three, increased sexual desire. Four, inappropriate or unhealthy knowledge of the body, body parts, etc. The impact emotionally can be as simple as being a child being open to sexual activities at a younger age that is inappropriate. Um, Two, affects later relationships in life, and how they attach to others and how they um, build relationships with others. Three, associating sexual feelings with feelings of fear, anger, anxiety, depression, so on and so forth. And four, children will often experience themselves as important only as it relates to their sexuality. All right, so now let's talk about intervention strategies. What are some of the strategies that we can use in terms of implementing in the work that we are doing with our children? Again, these strategies that we're going to talk about are there are two different kinds. So we're going to have proactive strategies and reactive strategies. Proactive strategies is which we're going to talk about first. Are really essentially the definitions are interventions which are used on an ongoing basis in an attempt to reduce the likelihood of the challenging behavior occurring as often as it does. Usually preventative strategies that usually deal with the conditions that precede the behavior. So, one of the proactive strategies that we are definitely going to consider is providing some psychoeducation about personal development and sexual development to the youth and the children that we are working with. Definitely, like we were talking about in earlier slides, that education piece and that knowledge piece, because they are curious, because they want to know, is extremely important. What you do with when you find out that they are curious and they want to know, what you do is the next important step, because what you do can mean that you are going to reach out and look for an agency or look for a person or look for some way to help support that need for information, or you're going to deliver it yourself. So again, that is extremely important. That education piece, again, an extremely important piece of all of this. Number two, having an open door policy. Engage with your child in such a way that they feel they can ask you questions. A lot of the trainings that we do here are usually encourage you to build a bond, build these connections with the youth. This particular strategy and having that open door strategy or policy so that the youth feel comfortable coming to you. Don't feel like they have to hide information from you, that you are somebody that is going to judge them, that is going to place some sort of judgment on them, and in turn make them feel like they can't trust you, that they can't open up to you, that they can't talk to you, and so they are going to look for information elsewhere. So definitely having an open door policy and being open to having dialogue and conversation is extremely important piece of this. Number 3, set up appropriate safety plans and address situational triggers for inappropriate and unhealthy behavior. When the behavior is already going on and it's already happening, you definitely want to make sure that you set up your safety plans. What is going to keep this child safe in this situation? Again, not only because you are a resource parent, but also because you want to maintain the safety of everybody around you, not only for yourself, for the kids, but for your own children. If you have your own children in the home, you want to ensure that everybody is safe. So ensuring that there is a safety plan for a certain situation, and this is granted that you already know that there's a behavioral concern or there is something that is going on that you need to be prepared for, and so you're going to address it by creating a safety plan. And there are also other triggers that you would sometimes have the need to consider to address that lead to having inappropriate or unhealthy behaviors. And so as those come up, make plans for and how to deal with those triggers that come up. So let's talk about the other general intervention strategies, reactive strategies. So reactive strategies, just so we give it a definition, are designed to keep the person and those around them safe from harm. So usually they provide a way to react quickly in a situation where the person is distressed or anxious and more likely to display challenging behavior. So it's important to note that when working with youth, and talking about their sexual development, their sexuality, and because this topic in itself is very touchy, you want to, one, avoid shaming, whether it is age appropriate or inappropriate. Shaming a child for their behaviors will likely trigger them to share less information with you. So again, going back to that proactive strategy that we talked about earlier, we want to definitely maintain that openness. We want to maintain that trust. We want to encourage that. We want that child and that youth to continue to share information with us, because the more closed off they are, the less likely they are going to be willing to accept help from us. Number 2, for children whose behaviors are likely age appropriate, but they are engaging them in inappropriate ways, address with them why the behavior was inappropriate and identify how to make better choices. Again, how to identify appropriate boundary setting and privacy. That those are important conversations to have. Making those appropriate choices versus those inappropriate choices, and defining that, having those conversations about what was inappropriate and why it was inappropriate, and having the conversations what can change or what needs to happen for it to be appropriate. Number 3, intervene to stop age inappropriate or concerning behaviors. So this is that reactive strategy where it's already happening or it's occurring, and so you must intervene at this stage to stop whatever's going on, whatever behavior that you are observing or that has happened that is now inappropriate and concerning, and you must redirect. Okay. Number 4, talk with child about the inappropriate behaviors and help the child identify triggers. It's important to identify triggers. Again, identifying triggers is also part of identifying, will also help you identify those proactive strategies later when you do or build that list of proactive strategies that you can do. But definitely identify those triggers. What is setting this child off? What is causing a certain stimulation? What is causing the child to react a certain way? And so identifying that is not only going to help you to help implement a strategy to help avoid the child from continuing to act inappropriately, but also help the child Finally, number 5, we often think of reactive strategies as bad. They are necessary things because things will happen, and we want to be prepared to deal with them. Proactive is great, but reactive is also necessary. I think that just goes along with saying that sometimes reactive strategies are seen in a bad light, but they are very much needed because situations will happen. Things will be going on that you are not prepared for, and you need to intervene in the best way possible. You need to not be closed-minded or shut down. You need to be prepared to deal with what is in front of you, especially as a foster parent, because you never know what's going to get thrown at you or get thrown your way, because you're dealing with a child that you may not even know or fully understand yourself. And so again, being prepared and being open-minded and being ready to react to and approach any situation that is thrown your way is definitely an important piece of foster parenting.
I'm Professor Jane Gilgun. In this video, I discuss how parents and others who care for children can tell the difference between appropriate and inappropriate childhood sexual behaviors. Here's the scenario. You walk in on 2 children, one's 4 and one's 5, one's a girl and one's a boy, and they're touching each other's genitals and giggling. What do? Is this appropriate or inappropriate? And the first question you want to ask is one child forcing another? You can tell by how they're acting. Are they both kind of giggly? Are they a little bit embarrassed, when you show up? Are they about the same age and size? If the children are giggly and a little bit embarrassed and seem to be interested in what they're doing, then this is simple sexual exploration, and there's no reason to be upset or concerned. You simply can say to the children, I can see that you're interested in each other's bodies and you probably have a lot of questions about them, so why don't you get dressed now and we can have a talk about boys and girls and their bodies and the differences between boys and girls. When you come upon a scene like this and see that one child is upset or distressed and the other child seems to be forcing himself or herself on this other child, then there is reason to be concerned. If the child is bigger, stronger, older, appears to be using threats or force, then this is inappropriate sexual behaviors, and you really need to do something right away, like say, you're going to have to stop this right now. Here are some examples of inappropriate sexual behaviors. A 13-year-old girl who is taking care of younger children has the children undress and she touches their genitals. This is inappropriate sexual behavior, and even if the younger children enjoy the attention, the chances are very good that they feel forced and they feel strange and they feel as if they didn't really have a choice in the matter. And so the girl needs special attention, and so do the 2 children. Another example of inappropriate behavior, and I hope this is obvious, is that when one or more children stick objects into the sexual body parts of other children. This is inappropriate sexual behavior, and parents and others who take care of children have to put a stop to it immediately. But the children who have been acted upon, as well as the children who have been sexually aggressive, require special care. Children who have been sexually aggressive require the help of a professional. Parents and other care providers really don't have the expertise to deal with this. Sometimes children who act out sexually with other children require relatively brief treatment with professionals. This can be several weeks of psychoeducation about human sexuality, some family therapy, some education of the parents about how to handle the children's sexual acting out. Now, this is for children who don't have histories of trauma of various sorts and who simply don't understand that this behavior is inappropriate. Some children who act out sexually, however, may have deep-seated trauma or may have trauma that nobody is aware of. The kinds of trauma that children who act out sexually sometimes have include sexual trauma, such as being sexually abused, or other forms of trauma like long-term neglect or physical abuse, or parental abandonment or deaths, or other kinds of things that the kids really can't cope with, but nobody's helped them with either. They are not necessarily sexually abused, they're simply traumatized, and they come upon sexual behavior as a way of helping them feel better. And they may need long-term therapy and education about sexuality and boundaries and all kinds of other things that are related to their sexual acting out. Group treatment for children, group psychoeducation, family therapy, couples therapy, and individual therapy for the children, individual therapy for the parents often is crucial for the children to learn how to manage their sexual behaviors and to work through the other issues that are related to their sexually aggressive behaviors. Parents often find that without realizing it, their own issues, the problems they may have between them, their own unresolved history of trauma may be playing into children's sexual acting out and other behaviors that the children have. So parents really have to become involved in their own work in making their own lives better so that they can become more psychologically and emotionally available to their children and able to guide children on how to behave in sexually appropriate ways and how to be appropriate overall. So even when children have problematic sexual behaviors, it's not the end of the world. What is required is parents who are willing to work on their own issues, parents who are willing to do whatever it takes for their children, and for parents to encourage their children to participate wholeheartedly in a range of treatments that the children may require in order to develop more appropriate sexual behaviors. It's important to remember that children do experiment sexually. When it's true experimentation, it's fun for the children, even though they might be a little bit embarrassed. They may giggle and laugh about it, and it's over very quickly.
So now that we've talked a little bit about proactive and reactive strategies that we can use, let's implement some of the stuff that we have learned. So we're going to do a few scenarios. We're going to read the story, and then we're going to answer the questions that come with the scenario. So let's start with Sally. So the story of Sally. Sally is a 10-year-old female who has been placed with her adoptive parents since she was 5 years old. Sally was a victim of interfamilial sexual abuse and was also the victim of trafficking from the time that she was an infant until her removal at approximately age 3 years old. Sally's parents have expressed concern that Sally often masturbates in a way that they feel is excessive and are concerned that she will often use objects that can harm her. She has required medical intervention on a few occasions due to her self-stimulation. So, question number 1. Might some of Sally's behaviors be age appropriate? So, looking back and thinking back to the ages and stages portion of the presentation that we have gone over today, what of Sally's behaviors is age appropriate? And the only one I can think of, she is a 10-year-old female, is masturbation. Again, self-exploration is appropriate for her age and at this time. However, one of the things that we have to definitely keep in mind is that her exploration has and is excessive. And her parents are expressing the concern that during this exploration, she has also been known to use objects that have potentially harmed her and have left her needing medical intervention on a few times. And so definitely that is the red flag. Not the fact that she is masturbating, because that is perfectly fine and it's age appropriate. However, how she is proceeding to do this is what would raise your red flag in this situation. Question number 2. What behaviors are of concern and why? Why are they of concern? So we just talked about this. What of those behaviors is of concern? The fact that she is masturbating is not necessarily the big red flag or concern in this situation. The fact that she is not only doing it excessively, but also using, like we mentioned earlier, just objects and things that are having to require her end up needing medical intervention. That is what we are definitely in this situation, in this scenario, definitely most concerned about, because again, this child is doing this and excessively to the point where they are hurting themselves. Number 3, how should Sally's parents address her behavior? So this is perfect in terms of what we talked about earlier about proactive and reactive strategies. So I'll give you a few. So proactive strategies in terms of addressing this, one of the things that I would do, or that I would suggest be done, is take all necessary means to control her sexual desire and avoid anything and everything that may lead to her masturbation. This particular strategy is you could use things such as, limit her internet access, limit her TV time, limit her access to her iPad, to her phone, etc. The point here, or the objective here, is to give her the least amount of opportunity or access to these things that are triggers for her, or potential triggers for her to initiate or masturbate. Number two on proactive strategies that I would use would be limit the amount of alone time that she has. So along with this, one of the things that I would definitely do is maybe create a schedule, keep her really busy, involve her in clubs, involve her in church, involve her in many different activities throughout the day, or keep her busy to the point where she has very little not only alone time but downtime, to where she is putting herself in this situation that is potentially harmful for her. Lastly, one of the others, the proactive strategy number 3 that I would use is, again, that education piece. That education piece is extremely important. What is appropriate, what is inappropriate, what needs to be done in private, what is not okay to be done out in the open, and what is not okay to do. A lot of education, that education piece is going to be extremely important, again, because you want to make sure that she is knowledgeable of the potential dangers of what she may be getting herself involved in. Reactive strategies. Let's talk about reactive strategies that in Miss Sally's story that that I would suggest be some good strategies to use. One would be, definitely, if this is something that you are observing and or you walk into, definitely intervene at the time that it's happening, that it happens. Because again, if you are walking into it, that means it's being done in an appropriate place or inappropriately. Again, so definitely intervene if you are walking into this or observing this this type of behavior. Number 2, don't be judgmental or shameful, but a reminder that masturbation should be done in private might be necessary. So again, don't judge the child. Don't be judgmental. It's going to be easy for you to say, "What are you doing? Why are you doing this right now? And you shouldn't be doing this. This is disgusting," so on and so forth. It's going to be easy to jump to those or to that stage as a parent. And as somebody who understands what's appropriate versus what is inappropriate, it's going to be easy to just jump to that. But again, you might be working with a child who does not understand that. And so again, jumping to being judgmental and being shameful of what is being observed might actually hinder the relationship that you have with this child. In this case, might even get to the point where this child's not sharing information with you, might be quiet around you, and so on and so forth. And so that relationship might be impacted by your reaction. So definitely, again, that necessary and conversation in terms of masturbation should be done in private is definitely also going to be one of the things that you want to include in that conversation. Number 3 of the reactive strategies that I would suggest in this situation, just remove objects that can be potentially harmful. Especially, you will come to know where and what causes and triggers Sally, and you will come to know what objects more or less she would be using. And so those are the things that in this particular suggestion I would say, hey, those are the things you might want to remove or limit access to, or only give access to her while supervised to those certain objects, because we don't know what she's using or what she's doing based on the scenario. But again, we want to remove all potential objects that can possibly cause harm or continue to cause harm, or she can continue to use that are going to be inappropriate and have her possibly end up in needing medical attention again. So again, those are just some basic proactive and reactive strategies that I would suggest. However, you are going to be key in any situation or any potential situation where this is happening, where you observe this is happening, or something similar may be happening in your home. And so you will be the judge of it. You will assess the situation. You will implement the strategies that you feel are going to be necessary. Okay? The ones that I mentioned are not necessarily the only ones that you should use or could use. There are many more. Again, you will assess the situation and you will know what is going to be appropriate to use for the time and the situation presented in your case. Moving on here to the story of Bobby. Scenario number 2. So let's talk about Bobby. Bobby is a 14-year-old boy who is currently in foster care. Bobby has been spending more time in the shower than usual recently, and his resource parents have noticed that he is beginning to develop facial hair. So key things to remember here is Bobby is 14, and the situation here is he's spending more time in the shower and he's starting to develop facial hair. What does that tell you? This kid might be going through puberty. A lot of different changes are happening to his body at this time. So let's look at the questions. What questions do we have to answer here? What are some of the age appropriate behaviors that are indicated here? So appropriate age behavior things, maybe not behaviors, but appropriate age things that are happening is based on his age. He's 14 years old, so it appears that he's developing some facial hair. So part of the things that we're starting to notice is continued development in terms of just maturing, and it looks like puberty is starting to come around, and so that is definitely one of the things that we are noticing, and a behavior that is occurring that we would say in this situation is age appropriate. Bobby is we're noticing that he's spending more time in the shower. Definitely age appropriate. Okay, not uncommon for youth of this age for that to happen. Those of you that have worked with youth of this age know exactly, or may have come up on a situation like that before. Number 2, let's look at what are some strategies that should be employed to support Bobby. So Mr. Bobby, let's talk proactive strategies. What are some proactive strategies that we can use? And these are just suggestive. Again, there are many ways to address a situation like this, but this is just suggestive. And the suggestion that I would say for number 1 would be education. What is appropriate? What is inappropriate? In terms of what's going on, in terms of growing, in terms of having those conversations of what needs to be done in private, in terms of having those conversations of do you need space, do you need private time, do you need alone time, so on and so forth. Those conversations you actually want to have. Now, before you get the opportunity to get there with the youth that you may be working with, it's going to take a lot of work. So again, remember, these are suggestions based on you have already done a lot of work with the child, and this child trusts you and is sharing a lot of information, and this child is accepting of the information that you are providing to them. Another strategy in terms of proactive strategy that I would implement would be, just that talk about maturing, sexual development, and puberty. Again, just like I mentioned earlier in the presentation, you don't necessarily have to be prepared to have these conversations. I don't think anyone ever is, actually. Um, and if you're not, and if you don't feel comfortable, just know that because it is happening, it does have to be addressed. This isn't something that you can just ignore and push under the rug and say, hey, maybe he'll learn magically, just like I did. That's not appropriate. You are here to meet the needs of the children that are in your home, and so we must do so. And so again, the strategies that we talked about earlier is, who do you go to? Who can you go to out in your community? Who can you go to that is going to be able to help support you give this child this information? Again, simple Google search might turn up that there's Planned Parenthood who you can go to and get information from. When you take them to medical appointments, you can ask the doctor and the nurses for information there. When you go at the school, you can ask the school nurse to provide some information there about sexual development, puberty, and maturing, things and changes that you can expect, so on and so forth. Again, this all brings it down is that education piece is extremely important, especially for this 14-year-old boy who is beginning to probably explore his body and, find things that are, pleasing, and he might even feel a bit ashamed or not wanting to talk about certain things if you just bring it up with him like that. So, okay, proactive strategies. That was that. So, reactive strategies. Things that you would do in terms of the reactive strategies that you would implement. Of course, if you walked in on it and you saw it and things was happening right in front of you, definitely you would intervene. Definitely intervene at the time that's happening. Again, I think we talked about it with the story of Sally earlier, is that don't be judgmental or don't be shameful. Again, it's that education piece that you want to implement, and just as a reminder that masturbation should be done in private, and absolutely it's okay to explore your body, and we should be the least judgmental and the least shameful to the child as possible. But yeah. Moving on to our scenario number 3. So now let's talk about the story of Martina and Alex. So Martina is a 16-year-old female who has been in foster care since she was approximately 10 years old. She has denied any sexual abuse history, but there have been reports of inappropriate sexualized behaviors in the distant past, so more than 3 years ago. Alex is a 15-year-old male who lives next door to Martina. Alex and Martina have become close recently, and Alex's mother tells you that she caught them in Alex's room with some of their clothes off. She has indicated that she does not want Martina and Alex to have communication in the future, and reported that she thinks that Martina is a bad influence because she is a foster kid. Martina overheard this conversation. Oh, this one is particularly very interesting. Okay, so let's see. Let's answer the question. So, are Martina's behaviors appropriate or inappropriate given her age, and why? So, Martina is 16 years old, and Alex is 15 years old. So, is she? And the situation here is that she was caught with some of her clothes off with Alex in his room. And is that age appropriate at 16? It may not be something that we want to see. It may not be something that we think that our kids should be doing at that age, but it is, of course, age appropriate. It is at this age, again, teenagers are looking to formalize some of those feelings, emotions. They're continuing to have that curiosity, and not only are they formalizing feelings, emotions, but also relationships. And with that comes, wanting to explore other areas and other urges that teenagers have because, because of hormones. And so, again, is this age appropriate given the situation? Yes. What strategies would you use in the future to help address the concerns that you have about Martina? So, what are some proactive strategies? And I think we've generally, over the last three scenarios, have generally talked about one of the best proactive strategies that you can have is that education piece. What's appropriate, what's inappropriate, things that should be done in private. Those conversations really need to be had. She appears to be starting to explore her sexuality in a more advanced way, in which she's now acting out on it with somebody that she probably cares for. It does say in the scenario that they have been getting close lately. And so she probably cares for this person, and so she's starting to act out on her urges, on sensations that she's getting in her body, and so is Alex, because during that age, that's what's going on. And so again, an important piece of it is now you know in this situation, now you are aware that this is happening. One of the things that in this particular scenario that we can't speculate on is if there's any sexual abuse history. The fact that this scenario gives us the information that she's had inappropriate sexualized behaviors in the distant past does not necessarily mean that we are going to speculate that she was sexually abused or had some sort of sexual abuse history because we don't have enough information. And so we can't go based off of that. But again, the thing that we can go off of is that, we know what's happening. We have established now that it's age appropriate. Yes, of course, it's something that we don't want to have to deal with. It's something that we would prefer both Martina and Alex wait till they're over 18 and possibly out of our homes. And that way we don't have to have those conversations. But again, this is likely a conversation, if you're working with this age group, that you are going to have. And so best proactive strategy that you can have in this situation is that education piece again. What's appropriate, what's inappropriate, that the sex talk, the so-called sex talk in quotations, this is going to have to happen. Again, if you are not prepared to have that conversation, it is definitely something that you need to seek community support, other community agencies, school in terms of the school nurse, or even at the doctor. How do you get support to provide this information to this youth who is, based on her behavior, showing you that she needs this information, and it would be appropriate to give it to her. And so again, proactive strategies, the best one to use in this case scenario, in my suggestion, would be that education piece. Okay, definitely another proactive strategy that you could use in this situation is if you want to limit the time that she spends alone with Alex. Another definitely good proactive strategy that you can use and do if you want to limit her opportunities to be alone and have the urges to continue to explore. So that would be another one that I would suggest. Moving on to reactive strategies. Reactive strategies, of course, if you walk in on it, or in this situation, just like Alex's mom happened to have walked in, you intervene. You intervene if it is observed. And again, another one of those good reactive strategies is don't be judgmental, don't be shameful at the time, and be as open minded as possible. They are teenagers. Yes, you're going to walk into a situation where it's like, what the heck is going on? What are you guys doing? Again, it's that surprise element. Like, what is happening? What are you guys thinking? But again, one of the things you want to refrain from is being judgmental or shameful. Again, um, you you want to maintain a working relationship with the youth, and being judgmental or being shameful at the time might not help you establish or continue that working relationship, because that child or that youth may decide to refrain from giving you any information anymore, or talking to you, or building any relationship with you. So again, it's also really good for uh, you know building those connections. Anyway, moving on here. It, it so reporting sexualized behaviors to the Department of Social Services. So extremely important, very brief and straight to the point that I am going to be on this slide. If you suspect child abuse, report it. Contact the CPS hotline immediately and make the report. Um, Contact the appropriate authorities immediately and make the report. If you have to contact law enforcement, you contact law enforcement. Again, as a foster parent, as a resource parent, you are a mandated reporter, and these reports of suspected child abuse need to be made by you. What if you catch your child displaying inappropriate sexualized behaviors? How do you address that then? This child is in foster care. And so you go, basically this, you do process of elimination. Is the behavior that you have observed or witnessing, is it child abuse? If so, it must be reported. Are you unsure whether it's child abuse or not? Well, if you are unsure, contact the hotline anyway. They can help you determine that. Definitely, if you are unsure of whether it's reportable or not reportable, just contact the hotline anyway. And they will help identify whether this is something that needs to be evaluated out, and maybe it's not child abuse, and or if this is something that needs to go further. Again, if you are witnessing and any sexualized behavior, whether it be appropriate or inappropriate, and you are aware of it, just as a safety precaution, always let the social worker know. The social worker that's working with the youth, always let that social worker know, hey, Johnny is, starting to spend more time in the shower, and he's starting to want a little bit more of his alone time. He is 14 years old or 13 years old, and is that normal? Yes, but definitely, if this child in your home displaying those sexualized behavior, any appropriate versus or inappropriate sexualized behavior, let your social worker know. Not that anything has to happen, or not that it is a bad thing or necessarily a good thing all the time, but just so that everybody is kind of aware of what is happening and what's going on in the home. But again, just to be really quick on this, in terms of reporting sexualized behavior, if you suspect child abuse, you report it to the CPS hotline or to the appropriate authorities. Finally, some final thoughts on sexually aggressive children. Sexually aggressive children, in particularly young children, if they are sexually aggressive, it is likely that they were probably victims of sexual abuse themselves. And so, one of the things that, as a foster parent, as a resource parent, that you want to keep in mind is that you don't know sometimes the situations that these children have been in, the traumatic situations that these children have been in. And they are coming into your home with a laundry list, 700, 800, 900, 1,000 pages long. And you signed up to help decipher and go through this laundry list. This is the reason why you are here, being a resource parent and a foster parent, is to help support these children who, unfortunately, in their lives, did not have somebody there in immediately, whether it had been their biological family, to help support them and be there for them in these situations. And here you are, these children are in your home, and this is what you have signed up for, and this is what you are to do. Help them through the situations, and so that they get the resources and supports that they need, and be that advocate. Be that strong advocate that when you hear a no, yet you know that this child absolutely needs a service, or you need support in any way, that your voice is heard, that whether it be reporting or saying things to the social worker and getting the social worker involved, to the school, and getting the proper tools in the school setting, to help support this child do well in school, or whether it be talking to the attorneys and making sure that this child's voice is being heard in court. Whatever it may be, just as your role and in your role as a foster parent, know that you have the utmost responsibility in getting that out and getting that done. You are the person who is with this child 24/7, essentially, or spending the most time with this child, and you are definitely going to be able to see what is best for them, and your voice is as important as any. The other thing that I just like to remind foster parents of is that you are, again, doing a job that not many could do. And make sure that you are taking care of yourself. Make sure that you are utilizing self-care and ensuring that you are ready to deal with the many tough situations that can come up on a daily basis. And so, again, ensuring that you are healthy, that you are 100% there mentally, and that you are ready to deal with the situations that are going to be present in your life now that you are a resource parent, is extremely important. Don't undervalue yourself. Again, good luck out there, guys. Have fun. Make those connections. Enjoy the families that you work with. Enjoy the children that you work with. Be safe. Stay out there. And again, have fun.